Sure. I mean, I think we've got some really interesting mechanistic data that the combination of Olaparib and PD-L1 inhibitors, or even maybe PD-1 checkpoint inhibitors, could potentially be additive and maybe even synergistic, right? Because when we utilize a PARP inhibitor, we create more DNA damage, we create neoantigens, and that allows the immune system to find the cancer and hopefully clear it. So we're starting to build that story around how that mechanism of action may actually be true. We are hoping that once survival data are available for the DUO-E study, that we will be able to offer the combination of Olaparib and Durvalumab to our patients with advanced and recurrent mismatch-repair proficient endometrial cancer. Because I think the use of checkpoint in mismatch-repair deficient endometrial cancer is a clear win, and it's hard to improve upon that, at least right now. But I think the addition of PARP in this space to mismatch-repair proficient can really help us potentially improve progression-free survival and, duration of response and overall improvement in outcomes.